when you're in acute low back pain, but you recovered from that absolutely most acute stage where you can't feel like you can't do anything, and now you're actually able to move around a little bit, but you're still very guarded in certain movements where you feel like, yeah, I just can't go there. So our first exercise I want you to keep doing, that we already did at level 1, is frequent walking. Those 10 minute walks on flat, stable ground, multiple times a day. Keep on doing that, at least 5 times a day. You need to be moving and keep your back moving, so it has the movement in it that helps the healing process. If you find it beneficial at level 1 to do the Kensey protocol, where you're leaning back and that decreasing the pain that you have shooting down your leg, our next couple of stages for that looks like this. So second level we ended up with in level 1 was here. So now we can bring ourselves up a little bit higher onto the hands. Once again, look ahead and retract the shin back. Just hold this for about 5 minutes at a time. And once again, if you feel pain, the pain in your leg decreasing, this is really good for you, and do this frequently throughout the day. You can even do it once every hour. And there's actually one more progression that's a little bit more advanced on this one. It looks like this. You get up to this position here, and you see, instead of keep my hips relaxed down onto the table, bring them up here, breathe in, and as you breathe out, I'm relaxing my hips down and just trying to stay down relaxed here for about 10 seconds. Then with my next breath in, bring my hip up again, and as I breathe out, relax it down and forward. You can do that cycle about 10 times, and that's going to be able to get more and more movement into your back and decreasing the disc protrusion, that expanding out the back towards the nerve and push them back forward into where the disc material is supposed to be and off that nerve. And if you find that that's just aggravated and you don't really have any pain shooting down your leg to start with, it's not the right exercise to do. Also, when you have acute low back pain, your core and muscles really start to switch off, and you're losing control of the muscles around the core. So we want to start to switch them back on again to make it safer to do your activities of everyday life. So our first exercise for that is going to be just to put your hands around your core like this, and then just contract everything at once, like that, just like you're putting a belt on. You can do that like 10-20 times at a row, and then give it a rest, and try to do that every hour throughout the day. If you have one of these Swiss balls, you can do that same exercise sitting on the Swiss ball. Just lock your core on and just gently bounce up and down.